Mari Stopes International is a leading provider of family planning and reproductive healthcare globally. We work in 42 countries around the world, delivering services to over 7 million women and men every year, and our mission is to ensure individuals can have children by choice, not chance. As part of our reproductive health services, MSI provides abortions using the safe and simple technique of manual vacuum aspiration, or MVA. MVA was developed in the 1970s and is now internationally recognized as a safe and effective method of surgical abortion for up to 12 weeks of pregnancy. MVA is recommended by the World Health Organization because it is a simple surgical procedure with low risks and can be performed without the need for a specialist setup or operating theatre. There is no need for general anesthesia. All clients should be treated respectfully and given appropriate privacy to discuss the reason for her visit. Provide her with all the necessary information that helps her to reach an informed decision. Prior to any MVA procedure, describe the process to the client and make her aware of the benefits and risks involved. Answer any questions and obtain her informed consent. At this point, contraception should also be discussed so that it can be used immediately after the procedure. The MVA equipment is simple to use and consists of a flexible plastic cannula attached to a single-valved syringe. The single-valve syringe consists of a 60cc plastic barrel, a plastic plunger with a removable sealing plastic O-ring, a collar stop, rubber teat, and a locking valve. The cannulae come in 4 different sizes and are used to gently scrape the walls of the uterus and aspirate the products of conception. In order to minimize client discomfort and complication risk, use the smallest possible cannula for the gestational age. For example, for pregnancies of 7 or 8 weeks, use size 5. There are 6 key steps in preparing and using the vacuum syringe. 1. Align the pinch valve, syringe and barrel arms. 2. Depress the pinch valve. 3. Create the vacuum by pulling out the barrel arms. 4. Check there is proper alignment of the plunger arms on the syringe barrel. 5. Connect to the cannula, ensuring not to hold it by the plunger arms. 6. Apply the vacuum by releasing the locking valve. The syringe creates the vacuum by locking the valve closed and pulling the plunger out. Always check that the plunger arms click securely into place to avoid the risk of the head of the plunger pulling the vacuum back in at high speed. Always charge the syringe before it is attached to the cannula. When the charged syringe is connected to the cannula and the locking valve is released, the products of conception are sucked into the syringe vacuum. Prepare the equipment tray before the client enters the procedure room. Cover metal or plastic trays with sterile cloth or paper and keep the equipment to the following items: 1 medium-sized speculum, cotton wool balls or gauze soaked in hexadine or povidone iodine solution, 1 pair of Stopes forceps, 2 flexible cannulae of appropriate size for the client's parity and gestation, and a single-valve MVA syringe. Always lay the tray out as shown. The Mari Stopes forceps are specifically designed to stabilize the cervix without traumatizing the cervix. The forceps are non-toothed and so do not create bleeding or pain when attached to the anterior lip of the cervix. When there is an anteverted or retroverted uterus, apply gentle traction to the cervix, pulling it forward so that the body of the uterus is in the midline and in line with the direction of the movement of the cannula during aspiration. The MVA uses a no-touch technique, so do not allow the tip of the cannula or any other instrument that enters the uterus to touch non-sterile surfaces, such as the vaginal walls or your hands. If you use the smallest possible cannula, you will not need to use cervical dilators. Insert the cannula into the uterus, holding the end of the cannula gently in between your forefingers and thumb, and gently twist it through the cervix into the uterus. There should be no need to use force, but you need to start with the smallest cannula size. Charge the syringe and then attach it to the cannula. Begin aspirating by releasing the locking valve to allow the products of conception to begin to flow into the syringe. Never hold the syringe by the plunger arms, as you may knock them off the edge of the barrel, which will cause them to be sucked back in, sending the products of conception and air back into the uterus. This could cause an air embolism, a dangerous complication. Aspirate the uterine contents by moving the cannula slowly back and forth, turning the syringe gently throughout aspiration. When the syringe is 3/4 full, close the pinch valve, leaving the cannula in the uterus unless you need to use a bigger size or suspect that the cannula is clogged. Empty the contents into a container by pushing the plunger into the barrel. Hold the syringe by the barrel and recharge it before attaching to the cannula. Check the plunger arms have been clicked securely into place. Continue until all the products of conception have been aspirated. You will be able to tell that you are at this stage when red foamy bubbles enter the cannula and syringe. The uterus begins to feel gritty and the cannula becomes difficult to move as the uterus contracts around it. Remove the syringe and cannula and leave the speculum in place until after you have inspected the products of conception in case you need to repeat the aspiration. If the aspiration is not progressing and nothing is entering the syringe, it may be that the pregnancy sac has not been aspirated. The uterus will continue to bleed and will not contract until the sac is removed. It is essential to get it out as quickly as possible. Rotate the syringe through 360-degree turns to wrap the sac around the cannula. If this does not work, use a bigger cannula size. Another possibility might be that the sac has descended into the cervical canal, in which case use the artery forceps to pull it out in a series of gentle tugs. Inspect the products of conception out of the client's view to ensure the procedure is complete and to avoid the risk of incomplete abortion or ectopic pregnancy. The client should remain on the procedure table whilst the products of conception are inspected. Empty the syringe aspirate into a strainer and rinse with cold water until the water runs clean. Transfer the washed products onto a clear flat-bottomed dish containing enough water to float the tissue and examine the products over a light sauce. You need to identify the pregnancy sac, and if you cannot, then return to re-aspirate the uterus. If there is still no sac, then suspect ectopic pregnancy or the possibility that she was not actually pregnant. As the MVA is a simple procedure, most women are ready to leave within 15 to 30 minutes. For over 25 years, Marie Stopes clinics have been providing reproductive health services. The manual vacuum aspiration procedure has been perfected by our global network of providers, enabling us to meet our customers' needs and to make sure that they can exercise their fundamental right to have children by choice, not chance.